pelvic tilt test is a test that we take a look at in those patients we suspect to have the lower cross syndrome. As we take a look at this, the first thing we want to do is check mobility in the lumbopelvic region. So I'm going to ask Justin, go ahead and tuck your pelvis into anterior tilt, rolling forward, and then tuck it back into a posterior tilt. We're going to have them roll back and forth a couple of times to see if they have good mobility. Particularly as your patients start to degenerate in age, you'll start to see that this motion alone becomes more challenging. And for a lot of you that do post-operative treatments, this will actually be your initial treatment plan. It's just a simple anterior and posterior pelvic tilt to start restoring that mobility. And you have to take into consideration that the strength of the deep abdominals and the lumbar erectors being able to coordinate here is an important characteristic for them having this anterior and posterior tilt. From there, I'm going to ask him to hold the posterior pelvic tilt while he slides the legs straight out the table. Okay? I usually tell him just rest the feet on the table as you slide out. Now think of this as a tug of war between the iliopsoas and the abdominals. And so what's happening here is if the iliopsoas is really tight, as in your lower cross syndrome, that's going to cause the pelvis to tilt anteriorly because of its attachment on the anterior ilium. If the abdominals are doing their job and they're strong enough, they will actually keep the pelvis posteriorly tilted and it won't be a problem. We can actually assess this even further by straightening those legs out with the posterior tilt and then asking the patient to lift the legs up about 6 inches. We'll take a look to see if they can keep that posterior tilt. This is going to be a much more challenging component for most patients, and it's not something that a lot of them will be able to do, but it is a way that you can take them to the next level in looking at their core stability.